Number 2 is cellular cell adaptation. Okay, cell adaptation. Okay, so what is it? Cell adaptation means what? That see, whenever there will be stress, I am telling you, whenever there will be stress, there will be some mechanism that is going to help the cell to survive longer. Okay, so this is the very theoretical part, but you will have to remember the examples. Please remember, you will have to remember the examples. So let me just write some of the example of cell adaptation. One is simply nothing but atrophy. What is atrophy? Atrophy means, see, if you are not using your limb, you can see in the CVA cases like hemorrhagic CVA or something. For long time, patient is not able to move his right limb or something like that. If patient is unable to move your hands or limbs or something like that, what is going to happen? Disuse atrophy. If you don't use it, it will get smaller in size, and if you don't use it, it will gradually shrink, okay, and get wasted. So atrophy, simple atrophy. So atrophy is seen in the case of, you just don't have to see in your you just don't have to remember the names, you have to remember the examples as well. Okay, so example of atrophy is, please write it down, denervation. Okay, denervation or disuse. You are not using. Okay, so disuse atrophy. So these are the example of what? Simply atrophy. Okay, number 2, simple atrophy. After that, we are going for hyperplasia. Okay, what is hyperplasia? The term hyperplasia should bring some memories into your mind. See, hyperplasia, so many places you have seen. Hypertrophy and hyperplasia are different. Please remember, my friends, hypertrophy and hyperplasia are different. How are they different? Hyperplasia means increasing in the number, whereas the hypertrophy is increasing in size. When young guys like you, they hit gym. Okay, so what do they expect? When they are hitting the gym, what are they expecting? That their muscles will increase. Okay, so that is not actually hypertrophy. Hyperplasia, it is actually hypertrophy. So example of hypertrophy, please remember, one more I am saying, that is hypertrophy. So example of hypertrophy are, what are the examples? I told you that whenever there is increase in size, that is already just a swelling. Okay, it is just a swelling. So that examples for hypertrophy are whenever you are going for muscle, muscle making, whenever you are doing exercise. Okay, exercise. Then these are the physiological cause. There should be some pathological cause as well. What are the causes of hypertrophy? Can anyone tell me? Yes, it is seen in the cardiac muscle. Left ventricular hypertrophy. You write LVH, left ventricular hypertrophy. All right. What about hyperplasia? Hyperplasia, I told you, it is increase in the number of cells. Okay, hyperplasia. See, this is different, hyperplasia. So where do you get hyperplasia? When you are growing. So in the puberty, you will have hyperplasia. Fetus will have hyperplasia, isn't it? Because the number of cells are increasing the number of cells in the organ or in tissue. That is called as hyperplasia. Okay. What about BPH? What happens in prostate in old people? Yeah, someone is saying something. What is happening? Yeah, very good. Pregnancy, excellent. Okay, so what I'm saying is pregnant uterus. See, remember, uterus, there are two questions. Okay, uterus will have hyperplasia and hypertrophy both during pregnancy. Okay, why? Because it will get thickened also in, it will increase in size also, and it will increase in number also. So both will happen during pregnancy. Okay, if they ask you what happens in a postpartum uterus, what is going to happen? Postpartum uterus will have atrophy, right? Because the hormonal regulation is lost and it is not getting used, so it will be having atrophy. Okay, so this is simple. You example are important, please remember that. All right, let's go to now inflammation. Okay, majority of this tissue injury in that inflammation. So after the damage, okay, how the damage happens, that will be, we will be seeing in the part, in the chapter known as inflammation.